Hi, I'm Dr. Ivan Puah, and I founded Amaris B clinic in 2004. I'm an accredited liposuction doctor and medical aesthetics doctor based in Singapore. I've been trained directly under Dr. Alfredo Hoyos and Dr. John Millard for visceral liposuction, and Dr. Pierre Fournier for liposculpture, fat grafting, and thread lift, and also under Dr. Delgado for dedicated surgical training in gynecomastia surgery in San Francisco. Fat grafting is an interesting procedure where doctor will harvest excess fat from one part of the body. For example, fat bulges from your tummy, from your waist, or any part, and use that fat graft to do corrective work or augmentation work on another part of the body. So essentially, it involves a liposuction where fat cells, fat layers are taken, and then the fat will be processed to concentrate and to prepare them. Once it's ready, the fat cells will be used to be transferred or injected to different parts of the body or face to acquire to the desired results. The common areas of fat grafting are usually face and body. We use it for either corrective work or augmentation work. Corrective work, for example, for scars from acne, scars from surgery, and of course, like for example, asymmetry, unevenness, so on and so forth. We use it as materials to fill up the gaps, to recontour the face and the body, and to improve unevenness, scars, and so on and so forth. Augmentation work involves, for example, breast augmentations to increase the size, to change the shape, augmentations of the buttocks, or even changing the size and shape of the face to make one look younger, to make one look different, and so on and so forth. So we can use it for either corrective work or augmentation work on the face or different parts of our body. The process is actually, on theory, pretty straightforward. We have to choose an area where the fat cells are healthy and is sufficient for us to do the work. For example, if we were to plan for augmentation of the breast, and we need certain amount of fats, let's say, for example, we need about 600 mils of fats, and then we need to find somewhere where there's sufficient fat cells to be harvested from. And the big areas such as the hips, waist, and sometimes even tummy will provide us enough fat cells to do the work. Once the fat cells be harvested, it will be concentrated, it will be cleaned, and be processed in certain ways to get it ready to be injected through tiny needles or tiny cannulas to the areas that we want to work on. The benefits of fat grafting is that we can use it as a filler material to fill up gaps due to scars, due to natural or synthetic asymmetrical condition and shapes, and to improve any parts of your textural contours. A good example is that after surgery, for example, appendix surgery, and you have a scar from a surgery which is uneven, which is probably asymmetrical, the best way to deal with it for some patients is to use fat graft to even up or even improve the contour of the scars. So we use it quite a lot for post-surgical, post-inflammatory condition to improve the scars. And we can use it on face, on body, on any parts of the face. Augmentation effects of the fat cells are more wide, and one of the most common requests for augmentation with fat graft is for the breasts. We can use it to increase the breast sizes, breast shape, contour, even for lifting purposes. The good example is to compare it with breast implants. The benefits, pros and cons of breast implants versus fat grafting for breast enhancements. One of the main advantages for using fat grafts for breast enhancements is that it allows doctors and patients to produce natural looking, natural feel results for the breast. And the results, if it's done properly, allows us to achieve very reasonable, very, very predictable improvements. However, there are certain downsides or risks of fat grafting, especially for enhancements. One of the biggest complaints from patients and doctors is that the size increase for fat grafting for breast enhancements is not as great as those who achieve it through breast implants. That's correct because fat grafting, once it's grafted, certain patients may lose certain portion of fat cells due to various factors. Therefore, when we advise patients for enhancements effects such as breast enhancements or buttock enhancements with fat grafts, there are certain size limitations that we often discuss with patients, and so that we are able to produce reasonable and realistic results, which is within the expectations. If we do that correctly, then most often than not, patients are happy with the results. Thank you for listening. If you have any questions, just email us. See you again.